The IU-Kenya partnership began in 1990 as a medical exchange program where Kenyan physicians and medical students would visit and receive training at IU, and IU physicians and medical students could elect to complete a rotation at a large public hospital in Western Kenya. In 2009, as part of this IU-Kenya partnership, Dr. Chite Asira completed a rotation at IHTC. He was a hematology-oncology fellow at the Indiana University, and he took this rotation as part of his fellowship training. While he was at the IHTC, Dr. Asira became familiar with the Hemophilia Center comprehensive model of care for bleeding disorder patients and asked if IHTC would help him start a similar program in Kenya. We took our first trip to Kenya in the spring of 2010. Although lacking in many essential resources, Kenya was rich in opportunity and an optimal twinning partner for IHTC.
The biggest challenge in establishing the hemophilia program in Kenya has been the ability to make a diagnosis. So most of the patients with bleeding disorders in Kenya do not have an accurate diagnosis.
They did the test on him. The results came out that he was hemophilia A. They realized the first test they did, it was wrong. He has hemophilia B. To me, it has been hard. That's why we've been going in and out of hospital.
What strikes me about the patients we've encountered in Kenya is that it is reminiscent of stories that patients in the United States have told me about growing up with hemophilia or trying to survive with hemophilia in the 40s and 50s when there was very little treatment available. Hemophilia is a disabling condition because one of the most common symptoms is a bleed into one of the joints, often a joint like the knee or the ankle. These are very painful. They lead to severe joint damage. Men with hemophilia may become very disabled because of a crippling sort of arthritis that they experience. Within the first year of visiting Kenya, we were able to assist the hospital in establishing a high-quality coagulation laboratory capable of diagnosing hemophilia. We've also traveled to Kenya with experts in blood banking to assist with increasing the local capacity to develop quality-assured cryoprecipitate and fresh frozen plasma, two blood-derived products that can be used to treat hemophilia when clotting factor concentrates aren't available.
We've had some wonderful experiences from both patients and their caregivers. This is actually the first time we've ever held a conference with caregivers and patients at the same time. We've only been holding for healthcare professionals, and so glad to have all these collaborations and our collaborators here with us.
This is Samuel, and when we first met Samuel, it was our first night, and he had a very bad right hip and thigh bleed and was carried in by his mother and was very painful. How he got the bleed was hopping around the house to try to get from the kitchen into his bedroom.
Can you bring your foot way up here?
So she carried him in. He was in a lot of pain, crying.
Yeah.
The next day, his mother was still carrying him. He was able to tolerate sitting, and also he was able to stand on his leg, which he could not do the night before. In order for him to walk, he needs to either very flex his right knee or hop or be carried. And presently, he's still being carried by his mother. Unfortunately, his mother does not have access to crutches, nor the finances to get those. Right now, that's where we are so that he can get around without having to be carried by his mother. And then we decided that we were going to try to get him some crutches.
Most of our patients were able to raise awareness. We've gone out into the community and talked to the healthcare staff and patients and their caregivers about hemophilia, so that now patients who are hemophilic are able to know about their disease status, their complications, so that now they are more empowered.
I think whenever we have a collaboration, there's a two-way benefit. I think obviously we hope that Kenyan patients will be able to benefit by receiving a diagnosis and gaining some access to care. There are other things besides just giving medication that are important. I think it increases our passion for what we do. I think the intellectual curiosity and the energy of the Kenyans helps to drive what we do once we return to the United States. Going forward, we hope to continue to enhance the treatment options available in Kenya, and we hope to find and diagnose as many patients as we possibly can. We've had the pleasure of hosting a number of Kenyan medical professionals at IHTC, and we certainly look forward to hosting more in the future.
I just want to thank members of the IHTC for the effort they've made to come down to Kenya to help us establish this program, because it's going to make great impact in terms of patient care in my country, and it will change lives, and we are very grateful for that collaboration.
Oh, Hambanati, siyabonga Jesu, siyabonga ngonyama Yesu, siyabonga Jesu, siyabonga.